Hello everyone. Today we will continue talking about active listening and empathic responding. Okay, here we are talking about a new response which is called placating or falsely reassuring response. Okay, what is meant by this type of response? Okay, for example, telling a patient who is facing surgery, do not worry, I'm sure your surgery will turn out just fine. Okay, هلا أنت بتفكرها as a pharmacist you may think it is helpful for him, but this response or this way is completely wrong because you are you think it is helpful. Okay, and this may help the patient. You think you may calm him, okay, but actually you do not accept the feeling as it is. Okay, you are trying by this way to change the patient's feeling, which is usually does not work. يعني بمعنى آخر إحنا هون بنحاول ما نحاول لازم إن نغير شعوره بإن مثلا نضل نحكي له لا أنا متأكد إنه أنت مثلا المرة الجاية رح تكون أحسن أو العملية، لأنه بهاي الطريقة رح يعتبر إنه أنت يعني بناء على شو أنت أكدت. أوكي، أنت بناء على إيش أنت متأكد. أوكي، فهو يعني نوعا ما رح يفقد الثقة وما رح يعني ياخذ كلامك من باب النصيحة، رح ياخذ إنه أنت مش فاهماه فعليا هو شو بيعاني. الصح انك تخلي معاناته اللي هو بحكي لك اياها وبيوصف لك اياها مثل ما هي. اوكي، تحاول تهدئه بس مش عن طريق انك تعمل له reassuring. Okay, reassuring response is taken place when we are trying to protect ourselves from emotional involvements. Okay, we are trying not to understand their feelings. Okay, this means انه احنا بنستخدم هذا الاسلوب عاده لما بدنا نتهرب او نحاول انه احنا ما نحمل الشعور تاعه، فاحنا بنصير زي انه نسرع بالقرار ونحكي له لا ما عليك، انه انا متاكد انه رح الامور تتحسن. يعني ما بدنا ندخل في نقاش معاه من حيث انه هو يشكي لنا اكثر عن الايموشنز اللي هو بيشعر فيها واحنا نحملها. اوكي، فدائما بنحاول ان نبعد عن هاي اللي هي الاسلوب من اللي هو الريسبونس. Okay, here in this slides are some examples of responses that is considered reassuring. For example, you will feel different tomorrow, things will get better, it is always darkest before the dawn إلى آخره. أوكي، فهاي حكينا إنه دائما نتجنبها لأنه إحنا ما بنكون فعليا متأكدين، بس إحنا بنشعر إنه إحنا متأكدين الأمور رح تكون أفضل وهو بنظره عارف إن الأمور ما رح تكون أفضل، فهذا بيفقد الثقة فينا. Okay. Here we have another response that is called generalizing. So we have to generalize according to the situation. Okay, of course this is an example of wrong response that should not be shown by the pharmacist. For example, you are telling the patient that I have been through the same thing and I have survived. Okay, يعني بالعربي بنحكي احنا للمريض مثلا انه لا انا عملت هاي العمليه والامور كانت تمام. اوكي، فانا زي كاني نفس الشيء ما بدي احمل شعور المريض. نطيت للكونكلوجن انه انا عملتها قبلك ويعني نفذت منها او انا عشت او الى اخره، او انه انا مريت بمرحلتك والامور كانت تمام معي. ماشي، بس هذا الحكي لا يعني انها رح تكون 100% معاه تمام. فهو بيشبه الريأشورينج، بس انت بتحكي له ريأشورينج by giving example او بتعطيه يعني خلينا نحكي experiment صارت معك، انه صارت هي معك كويسه وبالتالي اكيد رح تصير معها كويسه. Here are some examples, okay, of the generalizing response, like I know how you feel, I hate to wait in doctors offices too. يعني بتحكي له أنا نفس الشيء زيك، يعني مش لحالك. okay. or for example everyone feels that way، كل واحد فينا بيشعر هذا الحكي. اوكي، فهذا انت بتشعره هنا للبيشنت انه لا تشكي، مش لحالك انت هيك، كلياتنا هيك. فهذا الحكي طبعا خطأ، بيخليه يفقد اللي هو الثقة فينا انه هو يشكي لنا. اوكي، so we have to avoid generalizing response because The patient have his own feeling and he is sure that no one has the same feeling as he is, okay? And we are telling him that everyone have this feeling and he doesn't believe that is true. Okay. Another type of response is the quizzing or probing response. It is usually common for us to ask patients about his medication history or about his medication he is currently on and others. But we should avoid this response asking about things related to his medications or his diseases while he is expressing his feelings, okay? يعني نتجنب إنه نسأله هاي الأسئلة وهو يعني بيشرح لنا عن ايموشن أو مشكلة هو فيها أو فيلينج، زي كأني أنا بهرب برضه من سماع الفيلينج عن طريق إنه أنا بسأله أسئلة عشان أبعد النظر عن الإشي الشكوى اللي هو بيشكيها. لا, sometimes the patient, when you ask the patient about something related to his medication while he is expressing his feelings, he may think that by answering this question, you will give him a solution from the answer, okay? So this is a wrong way. يعني انت بتوهمه زي كأنه لما تسأله عن هذا الاشي هو لما يجاوب انه لقيت الحل، فهو رح يتفاجأ فيك انه انت ما لقيت الحل وبالتالي انت زي بمعنى اخر ضحكت عليه او غيرت محور الكلام. For example, asking Mr. Raymond how long he has to wait for an appointment does not convey an understanding of the essence of his concern, which was his perception of a lack of caring from his physician. For example, he is complaining from a long time from lack of caring from his physician, and you coming and ask him how much you have to wait before seeing this physician is not helpful way, okay? يعني لما تسأله قديش انت بتقعد ليش، فهو هون بحس انه انت يعني مش الاشي اللي اللي بده اياه يسمعه، اوكي؟ هو بده يسمع انه اوكي انا حاس معك، صح والله صعب هذا الاشي، بروح انت بتسأله عن الوقت، اوكي؟ فهذا الاشي خطأ. Here also more examples about quizzing response, about the questions. You can read them by yourself. Okay, here in this slide we have another kind of response which is called distracting response. طبعا واضح من اسمه, okay? It is obvious from distracting that you are trying to distract the patient and to change the subject, okay? For example, let me talk with you about the new prescription you are getting. This is a completely wrong response by the pharmacist to change the subject. So, what is the perfect or the ideal response? We talk about many responses that should not be shown or should not be conveyed by pharmacists. So, what is the ideal response? The ideal response is the understanding response, okay? هون احنا بنحكي عن الايديال. شو هو understanding؟ انك تشعروا انه you do understand him, okay? For example, you seem to feel there is something wrong or missing in your relationship with Dr. Johnson, that there isn't the caring you would like. لاحظوا هون احنا ايش عدنا كلامه بنفس الشعور لكن بطريقة مختلفة زي كأن عملنا يعني صياغة بطريقة ثانية. So this is the only response that indicate that you do understand the basis of Mr. Raymond's concern. Okay. Okay, here are some examples of the understanding response that should be told to the patient. For example, you feel like إلى آخره, you sound كذا كذا, you look like, for example, you are feeling, and others, okay? So here we are telling the patient about his feeling. We do understand him without judging, without saying he is wrong or he is right or others. Okay. Here we are talking about attitudes underlying empathy, or there is something called empathic attitude, which means that you are able to listen and try to understand the person's feelings, okay, and his point of view. You are able to accept feelings as it is without changing, okay, or without stopping the patient, without judging him right or wrong. And also not only to feel that you do understand another person, but to effectively convey to the person that you do understand him. يعني بمعنى آخر إن إحنا بدنا نشعر الناس اللي أمامنا إنه إحنا سمعانين لهم، فهمانين شعورهم من دون أي حكم لا إيجابي ولا سلبي عليهم. أوكي، ممكن نعمله عن طريق اللي هي إعادة الصياغة as we said. أوكي، وكمان مهم جدا إنه هو يفهم المريض إنه إحنا فاهمين إنه هو بده إيانا نفهم. أوكي، يعني إحنا يعني نعطيهم زي كأنه فيدباك إنه إحنا فهمنا شو أنت قصدك. أوكي. Okay. There are many non-verbal aspects of empathy. For example, there are non-verbal factors that convey interest and concern to the patient while giving him the understanding response. For example, establishing eye contact, leaning toward them slightly with no barriers, having relaxed posture, head nods, okay, tone of voice, establishing a sense of privacy, conveying that you have the time to listen, and sensitivity to patients' nonverbal cues like tone of voice, facial expression, and body posture. By using these nonverbal cues, you convey to the patient that you do understand him, beside the talking or the paraphrasing of his feelings by your words. يعني بمعنى آخر هاي النونفيربال الحركات يعني كيف اللي أخذناه بالسلايد السابق اللي هي الأندرستاندينج ريسبونس نحملها للبيشنت مع واحدة مثلا أو أكثر من هدول اللي هي النونفيربال كيوز عشان تساعد إنه يفهم البيشنت إنه إحنا شاعرين شعوره. Okay, here in this slide we will talk about some attitudes and behaviors by pharmacists that can damage the relationship between the patient and the pharmacist. For example, stereotyping, depersonalizing, and controlling behaviors. Okay, so what is meant by stereotyping? The image that we have or comes to mind when we think of, for example, specific situation. Okay, so we think about an elderly patient as they have a low level of understanding. Okay, AIDS patients, dying patients, non-compliant patients, and psychiatric patients. يعني احنا بناخذ فكرة عنهم هدول دايما في عنا نظرة إلهم، يعني ما بتنصفهم بأنه كل الناس الكبار مثلا استيعابهم بطيء، أو كل الناس اللي عندهم مثلا AIDS هم ناس مثلا دائما على علاقات مثلا مش صح، أو الناس الميتين هدول مش رح يستفيدوا إشي. هاي التعميم والgeneralizing والstereotyping should be removed from our minds. So, pharmacists who have stereotyping in their minds usually think like, I already know what he is going to say. If you have in your mind this sentence, so you have stereotyping. Okay, he is the type that never really wants help. Okay, يعني هاي السنتنسز إذا كانت عنا معناته إحنا عنا stereotyping، لأنه فعليا ما حدا بيعرف شو الثاني رح يتكلم. أوكي، فإذا كان عندك حكم مسبق شو هو رح يتكلم أو أنت عارف مسبقا شو رح يحكي معناته أنت عندك stereotyping. Okay, the second behavior that should be avoided, which is depersonalizing. Okay, we have to be careful from this behavior. Depersonalizing means that you perceive the patient as a case or just a number, okay, without dealing with him as a human. Okay, we focus on the disease rather than him. Okay, we may communicate with someone else, for example his wife, his son, not the patient himself. Okay, يعني هنا بنتعامل معاه كرقم ككيس. okay، ما بنتعامل معاه كهيومن، لازم نحكي معاه كهيومن. okay. Okay, the third behavior is controlling. It is easy to understand. So you control the patient easily by controlling him. طب شو بنعمل بالcontrolling him? For example, you have the authority to give the patient directions what to do and what he should not do. Okay, يعني اللي هو السيطرة عليه. Okay, here in controlling the patients may feel that he is not, or his opinion is not important at all, and just you are the one who judge on his case, just you are the one who will give him directions and instructions about his disease information or about his medications. Okay, so the decisions are made by you alone, without any or with little input from the patient himself. Okay, so and you do not care about message given from him, you do not ask for feedback. Okay, you just give him instructions and he should follow it.